Welcome back. Now, when you find out you're pregnant, some would think you would be happy for your bundle of joy on its way. But in reality, some pregnant women can become depressed. Our pregnancy expert, Judith Schuler, is here to tell us more about it. And Judy, is actually that kind of common?
Well, yeah, we're recognizing it more. I think it's probably already, has always existed.
Yeah.
But now we're being able to tell people more about it so that they can recognize it in themselves. About 25% of all pregnant women experience some degree of depression, and 3 to 5% have a severe depression. And treatment is incredibly important for the good health of mom and baby.
So what is the difference between just normal things that are going on with your hormones and the pregnancy and depression? Is there symptoms that we should be looking out for?
Yeah, symptoms, everybody gets down.
Yeah.
It
Right.
just happens. And but when you are going into a depression, it's much more intense. You may not have any appetite. You may have sleep issues. You either, for days, where you either sleep all the time or you can't sleep at all. You may have sadness that lasts for a long time. And then we've all heard about the women who have had problems, and hurting their children after postpartum depression. If you have thoughts of harming yourself, then you probably have a severe depression.
Yeah.
So you need to address that.
Do we have any indication on what could cause this?
Well, pregnancy hormones is
Yeah.
a big cause. We know that when women get pregnant, the hormones are released and it affects women differently. If you have had a history of depression or your family has a history of depression, you may experience a depression during pregnancy. Women who have had a miscarriage and women who have suffered from infertility sometimes have more issues. And even women who have had in vitro fertilization sometimes experience depression even when they're, because they've achieved a pregnancy, you see, but they have to give them so many hormones to achieve a pregnancy that sometimes it tips them over and they can experience depression.
So if you are finding yourself in that boat and some of these symptoms and things that we're talking about, how does that really affect the baby?
Well, it can affect you in ways that you probably would not realize. That through studies that we have now, we realize that women who have depression during pregnancy, mainly left untreated, can experience placental abruption. They can experience preeclampsia. Their babies can be born early or underweight. It's just so many things. And what we have found is that oftentimes women who experience a depression who are not being treated for it will try to treat themselves with alcohol or drugs or smoking. And so those things, you can affect the baby just in physical things that you do to relieve your depression.
So what is a correct treatment for that?
Well, the first thing to do is talk to your doctor about
Right.
it. You need to let him or her know. I've talked to women who have said, yeah, I was depressed the whole time, and they didn't even realize they should talk to their doctors. But there are many safe medications that your doctor can prescribe for you. Taking folic acid or B vitamins, even omega-3 fatty acids have been found to impact on depression, along with exercise and light therapy. And it's important to treat your depression during pregnancy because if left untreated, you are at greater risk of postpartum depression or postpartum distress syndrome, which is anything from baby blues to postpartum psychosis. And that is horrible for you and your baby.
Judy, I feel like some women, when you were talking about talking to your doctor, maybe don't bring this up because they think, does this make me a bad mom or does this make me a bad pregnant woman that I'm having these feelings? So I almost feel like there's a little bit of taboo in there, and that's why women don't really talk about it.
It could be, yeah. I think that women don't realize maybe sometimes that they're depressed. They just say, oh, I'm just feeling down today. But if it lasts and you can't sleep or all you want to do is sleep and you can't eat, you have to eat for the health of you and your baby. So if you're finding that you're just out of sync but for a longer
Yeah.
period of time,
Then you know.
then you know. You
Yeah.
really need to discuss it at a prenatal appointment.
This is exactly why we talk about it here. Get the information out. Let them know that that first step is the best thing to take, and that there are relieving things we can do.
There are things you can do.
Judy, thank you so much for coming,
Well, thank
as
you for having
always.
me.
Now, for you at home, for even more information about your pregnancy, you have to take a look at Judith's series of books to learn more. Go to yourpregnancybook.com.